Hi everyone. So I did my senior research project on mindfulness-based interventions for veterans with PTSD. And I focused on two interventions primarily, those being mindfulness-based stress reduction, which I refer to as MBSR, and Montrome repetition programs, which I'll refer to as MRP. And I focused on these two mindfulness-based interventions specifically because I saw a lack of research done within the nursing discipline on other mindfulness-based interventions. So these two were the most available to me. And then just to start with some term definition, mindfulness encourages present awareness of thoughts, feelings, and emotions with acceptance rather than with judgment. MBSR, as Klupfel et al. Described in 2013, is an 8-week program that may include health education, yoga, breathing exercises, and meditation. And it was created to help individuals regulate their stress response. And MRP is a repetition of a single word or phrase in order to create a state of relaxation. And these words can be as simple as still or peace. Really, the point of it is to find a word or phrase that is meaningful and inspirational for the individual doing the program. And then finally, PTSD, according to the National Institute of Health, is characterized by cognitive and mood symptoms, re-experiencing symptoms, and arousal and reactivity symptoms that are present for at least 1 month. And these symptoms interrupt normal day-to-day functions and can be very debilitating. So it's important for healthcare workers and nurses to be able to treat PTSD appropriately. Vujanovic et al. In 2011 described that more and more veterans are being diagnosed with PTSD. And currently, the main treatments for PTSD are focused on pharmacological methods, and Vujanovic et al. And the National Institute of Health described that there is low compliance and a low satisfaction with these pharmacological methods due to medication side effects and poorly sustained symptom relief. I found this a really significant problem because without proper treatment, PTSD symptoms can lead to a variety of negative effects. The two that come to my mind primarily are a lowered quality of life and an increased risk for suicide. In this diagram right here, shows that 20% of national suicides are completed by veterans, so the risk of suicide is definitely a concern for this population. The PICO question that I was seeking to answer throughout my research process was, in veterans formerly diagnosed with PTSD, what is the effect of mindfulness-based interventions, specifically MBSR and MRP, compared to treatment as usual on PTSD symptoms and quality of life? And for my research process, I used the Luther College Library website to access databases such as PsycInfo, Medline, CINAHL, and PsycArticles. I used phrases such as mindfulness and veterans and PTSD, meditation and veterans and PTSD, and mentalization and veterans and PTSD. And I limited my results by looking for peer-reviewed research published in the past 10 years. Search results ultimately led me to choose 2 feasibility studies for MBSR, 1 feasibility study for MRP, 2 quantitative studies supporting MRP, and 5 quantitative studies supporting MBSR. And I chose these articles because the research was medium to high quality, and all of the research was either level 3 or level 5 evidence. Now, it was at this point in my research that I really realized that a variety of mindfulness-based interventions have not been studied within the nursing discipline, and this presented as a red flag for me as well as a limitation of my research. But despite this, the research that I did found positive outcomes for MBSR and MRP on PTSD symptoms and quality of life. 5 studies found significant decreases in PTSD symptoms as well as symptom severity with either an MBSR or MRP program. 6 studies found significant improvements in well-being, quality of life, and/or mental health after an MBSR or MRP intervention. and the benefits from these programs appeared to be sustainable over time. This chart from Borman et al. In 2005 shows a significant decrease in trait anxiety and a significant increase in well-being for veterans with PTSD after an MRP program. And then this chart from Goldsmith et al. In 2014 shows a significant decrease in depression, significant decrease in shame, and a significant decrease in PTSD symptoms, as well as an increase in acceptance after an MBSR program. And just to review the limitations of my research, I saw a lack of longitudinal studies and follow-up after an MBSR or MRP program. At this time, research within the nursing discipline itself is limited, as I stated before. And finally, study samples were also not representative of the greater population because a majority of veterans with PTSD that participated in the research were male. So the conclusions that I drew from my research were not definitive. I think that the limitations are significant enough at this time that more research is definitely necessary. However, the outcomes of mindfulness interventions thus far look promising. So my recommendations for future research would be to include more nursing-based research on the topic. Studies should include more variety of mindfulness-based interventions, adding to MBSR and MRP. And research needs to have more representative samples of both male and female veterans with PTSD who have been deployed to different areas. And I think that qualitative studies are appropriate for this topic, but I see a need for more longitudinal studies to ensure that the positive outcomes are being sustained over time. So that was a quick summary of my research. I really enjoyed the whole process and hope to do more later on in my future. If you have any questions about my research on mindfulness-based interventions for veterans with PTSD, feel free to email me. Otherwise, thank you for listening.